My name is Maureen McCauley. I'm an occupational therapist at Slocum Orthopedics. I couldn't find a job that I really enjoyed, and one of the side jobs I was doing was coaching wheelchair basketball. And one of my players said I reminded her of her OT and rehab, and so I started looking into it, and that was immediately like, yes, that's what I want to do. So I work just with upper extremity, so shoulder, elbow, wrist, and hand. I have a schedule of patients that I work with every day, and so I see patients one after the other for 45-minute treatments. And sometimes I'm working with them independently, and sometimes I actually see them in co-visits with a hand surgeon that works here. So I'll meet with them, figure out what the problems are, if it's a fracture or a tendon repair, and then we do some soft tissue mobilization and then also give them appropriate exercises for wherever they are in their stage of recovery. At the end of the treatment, I need to do documentation, and then I see my next patient. The patient population that we work with is completely varied. Children typically have fractures, and elbow fractures for little kids, and then it becomes more like skateboard, snowboarding injuries for teenagers, and then you work into the adult population, and it's maybe more some fractures, some tendon injuries from work, and then maybe in the older population it's more again like fall injuries, wrist fractures. I enjoy the patients, actually the people that I meet doing my job. I mean, it's a very one-on-one situation, so you really get to know the person, and most people are very motivated to get the use of their hands back. So they're excited to sort of learn the exercises. Usually they're very nervous to start out with, and it's nice to give them that sense of comfort where they learn that they can move things again. Basic science is essential to have. And the other part is just enjoying being around people and talking with people. You have to have an occupational therapy degree, which at this point is a master's degree. So you need to go to college and get an undergraduate degree and then be accepted into a occupational therapy program. It's generally a 2-year degree after your 4 years of undergraduate, and you also have to count in that after that 2 years you have to do 6 months of internship after you graduate. Contact occupational therapists in your community and do just a job shadowing with them. I think that's the best way to kind of see if you would like it. There's a lot of opportunity, and it's a great career. You enjoy going to work each day, you're making a difference in people's lives, and have a good time while you're doing it.